Good evening. Good evening. Happy Wednesday. We are getting over the hump. Happy hump day. Hello, how are you doing as we welcome you into our live event? And I'll just give folks a few to join the room and introduce myself. My name is Chey Parker, and I am a host on the Quicksilver Morning Show on 92Q Jams in Baltimore. And we are on air every single weekday morning from 10 a.m. to 6 a.m. So I'm really excited to be here to have this discussion. This is one of many for me, but this is the first time that I'm going to be talking with our two guests that we have on today. And today's discussion is going to be all about diabetes. Unfortunately, we know that diabetes affects those of us in the Black community or those of us who are of color disproportionately. It's a serious issue in our community. And we live in a day and time where there are so many different issues and things that are drawing on our attention. We live in a very fast-paced society, and a lot of times we are not taking care of our health the way that we need to. So we want to talk about, how this disease, affects us, what we can do to manage it, to live healthier lifestyles. And what I always like to say, the more you know, right? The more you are informed and educated on the things that do affect you and also affect your loved ones, the better you are equipped to face those things head on when you do encounter them. And I don't know about anyone else, but I know for me specifically, and pretty much everyone that I know, my friends, my family have either 1 degree, second degree, or third degree separation from, someone who is, battling diabetes and who's living with the disease. For what we know as we, continue on in this life, there are those of us who may not be, diagnosed with it at this time, but, maybe at a later time, in life. So without further ado, I'd like to introduce both of our panelists who I'm super excited to have here tonight. And a special thanks also to, the University of Maryland Center for Diabetes and Endocrinology. Hopefully I'm saying that right. The crazy part is that when I do these webinars, there's always something that I learn new, a word that I learned that's new, and also an acronym that I learned that's new. But Dr. Rana Malek, how are you?
I'm so happy to be here. Thanks for having me, Chey.
Yes, absolutely. And I'm going to give you, an opportunity, to introduce yourself. But I'd also like to introduce as well for our event tonight, Kiya Rivera, who is a registered dietitian and diabetes educator. So I'll let first you, Dr. Malek, introduce yourself and talk a little bit about what you do and your experience with diabetes.
Okay. So my name is Rana Malek. I'm a professor of medicine at the University of Maryland School of Medicine, and I am the medical director of our Center for Diabetes and Endocrinology, which is based at the University of Maryland Center at Midtown campus. And I went into endocrinology. I decided to do it while I was doing my training in Atlanta, Georgia. And I realized that the unifying disease of the sickest patients I saw in the hospital was diabetes. And I went into medicine because I really wanted to make a difference. And I said, well, if I went into like a specialty that let me do a lot of diabetes care, and if we can do it well, maybe we can prevent a lot of those complications. And so I've been practicing at the University of Maryland since 2011, and it is such a reward to do the work that we get to do. And I get to work at the center with Kiya. We work together there.
Awesome. Yes, that's great. Okay, so yeah, we'll definitely want to dive into how you two also work together, especially for patients that you're seeing. And Kiya, tell everyone a little bit about who you are and what you do in your experience as well with diabetes.
So I'm Kiya Rivera. I've been in diabetes as long as I've been a dietitian, going on 7 years. Excuse me. And I started in a mental health hospital with children, and they happen to have type 1, type 2 diabetes, obesity, and or an eating disorder coupled with a behavioral disorder. And so I got a chance every day to meet one-on-one because it was an inpatient facility and kind of learn about their lives, but also look at their blood sugar numbers and see all these patterns. And my curious brain was like, why is it going up? Why is it going up? Okay, are they counting the carbs? What's going on? And then I just became very fascinated by that. And then just recognizing kind of at the same hand, wow, what a prevalent disease. Type 1, of course, is the lower percentage of those with diabetes, but just being able to make that difference and an impact through education just really was amazing. And building those relationships with patients is just amazing. Very rewarding, very, very rewarding.
Yes, that's awesome. And I love the title of our discussion today. It's called "Building Up the Health of the Community." So very important. And after this discussion, we not only want to, of course, talk about the disease and how it impacts our bodies and also our mental health, but what tools we can use and what resources are available for people out there who are dealing with this disease. So before we get started, we of course want to ask the number one question that is important to just lay a foundation for what we're talking about here, especially if someone's on the call who doesn't know what diabetes is. Maybe they have a loved one that was recently, diagnosed, or maybe they were diagnosed. What is it? And Dr. Malek, I'll start with you.
So a broad kind of definition is that diabetes is a chronic disease where your body doesn't make insulin properly, or your body can't use insulin properly. And the reason that's important is that when we eat any food that is a carbohydrate or a sugar, we need the hormone insulin to allow our cells to use that sugar as energy. So if you don't make any insulin, or your body can't use that insulin properly, then you don't have a way to use the sugar that you're eating as energy in your body. And so then you have high blood sugars and the symptoms and the complications that go with that.
Wow. Okay. And is this something that you can be born with, or is it something that you get later on in life, or is it something that you genetically just have a gene? A lot of times you'll hear a lot of people talk about, oh, everyone in my family, battle diabetes, or there's some sort of, illness or, disease or condition that, a particular family may, have down their bloodline. And Dr. Malek, I'll throw that question to you.
Yeah. So it comes down to the different types of diabetes. So there is type 1 diabetes, which a lot of us think of as the disease that kids get. And that is a little less true as time goes on. And what I mean by that is the kid is fine, or the person is fine, and then their body attacks the cells in their pancreas that make insulin. It's an autoimmune disease, meaning your own white blood cells attack those cells and your body won't make insulin anymore, and you need insulin to live. So that's type 1 diabetes, and those people need to be on insulin for the rest of their life. There's some genetics involved in type 1 diabetes, and then there are other things that we haven't figured out. Some environmental trigger that takes someone who is at risk for type 1 diabetes and then goes on to develop it. And while we think of it as happening in children, we also have adults who can be diagnosed with type 1 diabetes. In fact, I had a patient who at the age of 70 got a diagnosis of type 1 diabetes. So it can span a lifetime. The most common diabetes is what we call type 2 diabetes. And that's where your body does make insulin, but either it doesn't make enough insulin or your body can't use it properly because it's resistant to that hormone. And type 2 diabetes is the one that really runs in families. So when you hear people and they're like, oh, my grandmother, my grandfather, my aunt, my uncle, everyone has diabetes in the family, that's usually type 2 diabetes. diabetes. And so when I see people who say, oh, my family, it runs in my family, I'm like, well, you've definitely bought more tickets to the lottery, but it's not always destiny that you'll get type 2 diabetes. There are things that you can try and do to prevent that. And then you asked, it was something that you said was like incredibly scientific and appropriate for the University of Maryland, because there is this whole other classification of diabetes that it's called monogenetic, meaning there's one gene that causes diabetes in that person, and it runs in families. So it runs from parent to child to grandchild. And it's actually something that we specialize in at the University of Maryland, because we think a lot more people have that than we think. And we actually do a lot of those studies to try to diagnose that. But that's broadly how to think about diabetes.
Okay, that was a great explanation. And Kiya, I want to throw it to you because as we stay on the topic of the different types of diabetes, how does that relate to sort of the foods that we eat just regularly throughout our life? Can you put it a little bit in perspective as far as like, what are the foods that sort of advance, different types of diabetes? What's in our food, or what are the foods that we eat that we don't know that we're eating that are unhealthy for us or put us at risk? And I'm sure you can probably talk about that for days, but if you could try to put it in so many words from that perspective, that would be awesome.
Oh, yeah, absolutely. So Dr. Malek had mentioned carbohydrates. That macronutrient is what's going to cause the biggest spike to our blood sugar. Proteins and fats, the other two of the three macronutrients, aren't really going to cause that spike if you were to eat the protein alone for most of us. In most situations, or a tablespoon of oil, like fat alone, for example, your blood sugar is really not going to change a whole heck of a lot. But carbohydrates are what's going to impact them the most. So a large part of my job is teaching people how to read nutrition labels, see what foods are carbohydrates, learn which components to even start with. Do I even need to bother, counting my chicken, for example, or knowing what's in my chicken as far as blood sugars, and maybe they're dosing their insulin according to their meals. So a large part of what I'm doing is educating them on those basic macronutrients. And then oftentimes my type 1 patients, we're going through a lot of carb counting, nutrition label reading, maybe dosing as well with what the provider has recommended. And then looking at how to balance those meals so that we're kind of seeing a more even spike versus these trends, very drastic significant upward trends, and then drops back down. So teaching them how to not only learn to count carbs or and be able to read labels, but just being able to balance those meals in a simple form and try not to go, long periods of time without eating, things like that. But the hardest part and more important part of my job is all those things, trying to figure out and work with people on what that looks like in their daily life. Because we can educate and talk about, oh, you need to read this label and count these carbs. And they might know very well how to do it with ease, but it might be their lifestyle is so busy. How do they build that in? What does that look like? And can we get to certain doable, very small maybe goals that over time lead to the largest changes? So I spend a lot of my time kind of doing those individualized planning and strategizing and problem solving with the patient, that back and forth. And oftentimes I have to remind them, like, I know it's going to be a lot of questions answering. I'm just problem solving. Because that's really what it is. It's a lot of problem solving.
Yeah, no, absolutely. And okay, yeah, we just got a question that popped up, and I'd love to answer it since we're on the topic of carbs. Hello to everyone in the chat. Thank you for joining us. And so the question is in regards to carbs. Is there truth in the fact that wheat pasta is healthier than standard pasta? That is an awesome question. Kiya, we'll throw that to you.
All right. Yeah, great question. And I get this question a lot. So one thing that might be a little different is more specifically picking on healthier, right? So I try to not generalize foods as like good or bad or not healthy or unhealthy, but more kind of look at it as a whole picture. So when I think of wheat products versus, white products or products with enriched flour, I'm looking at the other things, that protein and fiber component specifically that you'll find in your wheat products or your 100% whole wheat, whole grain products. That protein and fiber component that the wheat products tend to have will typically help, not always, but you have a better chance of controlling the blood sugars with those being in the wheat products versus your simple or your enriched products, like white pasta, white bread, not a whole lot of fiber usually or protein. You might not find as much of a stable rise in the blood sugars. So not necessarily that one's not so good or not so bad, but what we do know is wheat is going to be less processed overall, because both are going to be processed, but that fiber and that protein piece that we do see in the wheat counterparts is going to help the blood sugars rise. Again, not always, but is more likely to help the blood sugars to rise a little bit better than that lower fiber, lower protein counterpart.
If at any point do we need to stop eating bread? I mean, we all know what bread does to you, right? It puts the pounds on. You're kind of bloated, kind of fluffy, and then also too, if it's a carb, and it can affect the management of your diabetes. Is there ever a situation where you're, telling someone like completely like avoid bread, pasta, wheat?
That's a good question. I really try, unless someone has an allergy, a food allergy, that is, I really try to say, avoid this. Only choose that, because it can start mentally impacting your relationship with food. And so instead of thinking as food as something that's going to nourish me and fuel me and give me vitamins and minerals, we start thinking about, oh, it's bad or it's good. And then it gets I like it called dicey. So one, I hope we don't ever have to stop eating bread, because I do like bread, but we can do some things in relation to what we're reading to see what happens to our blood sugars, right? So with diabetes, the hope is, if of course insurance, you have coverage and everything, and it's an appropriate situation, directed by your provider, of course, that we're checking those blood sugars. And I tell a lot of people that's really your ticket to see how certain foods will affect you, because everyone's going to be different.
Yeah.
One person might have a much different rise to the same slice of bread, same ingredients, same brand than another person. And that's just one factor, right? Because food's just one thing that's going to impact the blood sugars, but there's 42 other factors. If we look at, I don't know if I can mention diatribe.org, a really good resource, talks about like sunburns impacting your blood sugars, poor sleep, stress, pain, for example, delayed medication, say you get busy, you take it late. What does that look like to the blood sugars? So the interesting piece I always find is, yes, I'm a dietitian and I do talk a lot about food, but there's so many other pieces that I'm also trying to kind of educate the patient on, of this is also impacting things as well, and what's going to be the most doable and most practical thing to work on.
Yes. That makes a lot of sense, especially like living in the world that we live in. I can imagine that would help, just any of us trying to manage our health, or, any conditions that we may be dealing with. But of course, especially diabetes within this conversation. We have another good question. And I think this leans into, the types of diabetes. Is diabetes curable? And Dr. Malek,
Yeah.
can you answer that for us? Give us the news.
It depends. So type 1 diabetes, the one where your body attacks the cells that make insulin, is not curable, unfortunately. We're not there yet. Type 2 diabetes, like I said, is that catch-all, right? It's where your body doesn't make enough insulin, or your body can't use it properly. Depending on where you are in your type 2 diabetes kind of journey, it could be curable. What do I mean by that? We do know that people that lose really significant amounts of weight, if they are obese or overweight, can in fact reverse their diabetes. And we know that if that happens naturally, like through diet and exercise and lifestyle changes, we also know for people who have had weight loss surgery, we know that we have seen cure from diabetes from weight loss surgery. And so if we're defining cure as being off all medicines for diabetes with normal blood sugars, we can see that in some cases. Not in all, but in some. So if really the thing that's really driving that person's diabetes is their overweight or obese status, then if we can get some weight off, we can see, if not a cure, we can often see a huge improvement in the numbers. And as I always say to my patients who've done an amazing job of losing weight, there's a reward for good behavior, and that's usually me coming down or taking off some of the medicines they're on.
Yeah. Yeah. And that leads me into another, good question from your explanation there. The connection between the reversal of diabetes when it comes to, weight loss, whether naturally or through, weight loss surgery, is that a matter of, the physical, weight coming off and the stress that it may be putting on the body, reversing the diabetes, or is the change really happening in the change of the lifestyle? And both of you can actually answer that, from your perspectives, or is it a little bit of both as well?
I think it's probably a little bit of both. I mean, the weight is a huge part of it. Now, lifestyle can make a tremendous difference. And, I'm 100%, Kiya is so right. You don't talk about foods as being good or bad, but you know that some foods are probably better for your health than others, right? I know that like piece of ice cream cake is delicious and I want it in my life, but an apple is probably a better choice to do, right? And so, choosing foods that are healthier just on their own without weight loss can improve your blood sugars. I have had patients where I'm able to take them off insulin because they stopped drinking soft drinks all of the time, like Coca-Cola, Sprite, Pepsi. I had a patient who used to drink 2 to 3 liters of soda a day. We stopped that. We're able to get them off insulin, right? So there are both the food choices that a person can make, and changing those can improve your diabetes. And then on top of that, if there's also weight loss in a healthy sort of way, we can also see that improve your diabetes.
Makes sense. And Kiya, do you have anything that you'd like to add from that when it comes to, the reversal of diabetes and the connection there with weight loss and food?
I just keep thinking about the soft drinks, because that praise be it, because that's that might be the only thing I can kind of focus on, and it's a doable change, because it's a very impactful change. So it's again very much, what's going to work well for you. But I have soda bottles in my office that show you how much sugar is in each bottle, and people don't recognize, wow, that's just like a quarter cup of sugar. Imagine just pouring that in your mouth. And then sometimes that's that visual impact. You're like, oh, wow. And it's like rocket fuel. It's just straight sugar. It just drives your blood sugar straight up. And it can be very kind of, addicting in a sense, because of that sugar, and then that crash sometimes that can happen afterward that makes you want more caffeine or more sugar. So I do agree wholeheartedly. Definitely healthier food choices, and if we could, come down on those soft drinks, lemonades, even 100% fruit juice, although it's maybe not high fructose corn syrup or something else, it's still just straight sugar. You're better off having that full apple than that cup of apple juice, because you get the fiber in that apple and the vitamins and the minerals that'll have a better impact on your blood sugars.
Okay. And while we're on the topic of, because I'm a lemonade lover, okay? I love lemonade.
Sorry, Chey.
Oh my goodness. If I'm not drinking lemonade, I am usually probably drinking water, but I also love cold pressed juices. Can you talk a little bit about how, like, what their effect is on our bodies, and are they good for people to drink for someone, who has diabetes? Does that play into, where their blood sugar levels are?
So I kind of go back into like that problem solving scenario. So one thing, if the person does have diabetes, because I work with pre-diabetes as well as, obesity, again, trying to see what their sugars are after they're having their pressed juice or something else, and then seeing are they willing to give that fiber, that pulp that oftentimes people tend to throw away when they press their juices, because that's that good stuff that's going to potentially delay that blood sugar rise, and seeing if we need to work on something like that. But one thing just to remember, or kind of think about, is if you were to have like an 8-ounce glass of orange juice, right? So I'm kind of thinking probably about that, and you got maybe this big. I'll do that a lot with my hands for portion sizes. You might get about 4 to 5 oranges that you'd have to squeeze into that juice. But if we think about it, do we eat 4 to 5 oranges, 4 to 5 apples in one sitting? No. So we've kind of altered the really good things about fruit and fruit juice and vegetables, and we've made it a way to just be a little bit dicier for us. Again, if it doesn't really impact your blood sugars a whole heck of a lot and that works out, I'm fine. It's a way to get, a little bit of your fruit, your vegetables in, especially if we're not, it's not as easy for us maybe to cook them or have them with the meal. It is a good way to insert it in somewhere. But again, it kind of goes back to you're better off, at least in my mind, having that whole vegetable or that whole fruit versus pressing it out and kind of humanizing it in a way, right? Processing it in a way that our body's not maybe intended to break down.
You're breaking my heart, Kiya.
I'm so sorry.
You're breaking our hearts. While we're still on the topic of sort of beverages, we will throw up our next question. How bad are diet sodas? And do you recommend someone, who is dealing with diabetes to drink diet sodas as an alternative? Kiya.
All right. I was going to say, who goes first?
We'll get two perspectives.
Yeah, this will be interesting because I'm curious. I'm curious to hear Dr. Malik's, Malik's, I guess, education piece. So my education piece as a dietitian is, again, I'm trying to think as a whole, right? So keep that in mind. If we're choosing, say, regular soda instead of the diet soda, if we just take out, artificial sweeteners potentially causing cancer, stroke, Alzheimer's, so on and so forth, which there aren't any, to my knowledge, Dr. Malek will probably correct me if I'm wrong, that studies that show a causation like that. So just keeping that in mind, if our choice is a diet soda, regular soda, and nothing, because oftentimes I'm trying to fight people to drink water, I know that the diet soda is likely not going to cause any impact on their blood sugars. Okay, so I'm keeping that in mind. So if the other alternative is regular soda, right, in this case, we're not thinking of water. I wish it would be the third option. But if our other case is regular soda, I do know that we're going to have those blood sugar spikes. It's guaranteed pretty much. So I pose it to people. I share with them, to my knowledge, there's no research that shows if you take this amount, so on and so forth, you're going to get cancer. There was a study back, way back, the 80s, I think. They had given rats, not humans, they'd given artificially fed chow, so mice food, rat food that had artificial, feed in it. And they gave the other group, mice, regular chow. And they did see that the mice who had the artificially fed chow, they did show some insulin resistance, meaning they saw the blood sugars rise a little bit. So that's something to think about, right? So one thing, when you do look further in that study, it was a lot of artificial sweetener in this case, or artificial chow, something like, I don't even know, maybe 50 times more than they would ever recommend someone to consume, a human. Okay. So I share that with people, and I share with them, if you're willing to switch from regular soda to something that is more water, not necessarily, juice or lemonade, because oftentimes people think that's the better option, but really soda, juice, Chey, lemonade, sweet tea, they're all going to have a very similar effect on the blood sugars. Okay. So I try to come at it from that angle. I try to, really see if we can do seltzer waters. Can we try something maybe that's not artificially sweetened? We can flavor up the water with, like, you can do orange slices in your water with mint, and there's so many different things, cucumbers in there to give it a little, zhuzh, little taste to it. But oftentimes I'm finding that if I share with people, it's soda or water, they're going to keep drinking that soda. But if I'm like, hey, we have this alternative, there's more of a doable approach, I think, for them, not speaking for them. So in moderation is my key. I don't want people drinking, a 2 liter or, even a liter of diet soda all day, especially if they're eating products that are artificially sweetened as well. All the sweeteners do have acceptable daily limits. It's based off of your weight, your body weight, and you can find that. You might have to do a little bit of digging. But there are acceptable safety limits that are out there that you can kind of delve into if you're really concerned about that artificial sweetener.
Yeah. Okay. That makes sense. My heart is still broken, but now I do enjoy salsa water. So shout out to everyone out there that's into the sparkling water jam. And throwing some fruit in there, is always, nice, or some cucumbers. So before we take our next question, I want to switch gears just a little bit and talk about the prevalence of diabetes, especially here in Baltimore. You both work at the University of Maryland, so I'm sure you kind of have a good idea across the state what that looks like. But even more specifically, if you can talk to how it affects the city of Baltimore, that would be definitely insightful for our viewers. And Dr. Malek, I'll start with you.
Yeah. So, diabetes just across the country is very common. More than 30 million Americans have diabetes. A lot of them don't even know that they have diabetes. And interestingly, it's not uncommon for cities to have higher rates of diabetes than like suburban communities. And even more so, the more disadvantaged parts of cities have higher rates of diabetes than more advantaged parts of the city. And there's a lot that kind of goes into that. Some of it has to do that there are higher rates of diabetes in minority groups like African Americans, Hispanic Americans, Asian Americans, Native Americans. We also know that individuals who don't go beyond high school for education have higher rates of diabetes. So that the higher your education level, the lower your likelihood of getting diabetes. And we know here in Baltimore, data from the Baltimore City Health Department shows that about 14.5% of African Americans in Baltimore City have diabetes, compared with 10% of white individuals in the city of Baltimore. So it's more common in those in communities of color. The reasons for that, they're really complicated. So that while there may be genetic predisposition, there are a lot of environmental factors that impact your risk of developing diabetes, right? And so access to healthy foods is really important. So if you live in a food desert and there's no grocery store and you basically have corner stores, right? A lot of your food options are processed foods. You may have less access for places to do physical activity, right? Places to run, ride your bike, go for a walk. And we also know that we're starting to look more and more at the impact of in the environment, environmental pollution, endocrine disrupting chemicals, and those impacts on the development of diabetes. And those things really seem to disproportionately affect urban populations, and in particular, urban populations who are individuals of color.
Wow, that's really interesting. All of the intersectionality that sort of goes into that. Can you talk a little bit more about the education parallel? Because I'm assuming that the higher in education levels you go, that, people may be more informed about, the different foods that are, good for their body, different lifestyles, also able to have, better jobs. So they're able to afford, better food and, all of the like fun, exercise activities that we see out there, like Pilates, that's literally like what, $500 a month or something crazy. I don't know. But can you talk a little to that connection?
Yeah.
And it almost feels like, okay, well, these are also components of our society where, everyone's not going to have like the same, access to, education and to healthier food options. So how do we even battle that?
Yeah, I mean, I think you kind of answer the question. You hit the nail on the head, right? There is all the opportunities that come with education, and those are economic opportunities, and right. And so again, access to healthy foods, access to healthier environments that you can be in. But I can't stress the importance of education. And even me sitting on this YouTube with Kiya, just listening to her talk, I never get to actually hear what the education sessions are like for my patients. They sound amazing, right? And I think that just hearing any education exposure you have, where you are taught the concept of foods, where you're taught that, oh, the more they process the food, the more unhealthy it is for my body, right? I can't tell you how many people are like, what do you mean juice isn't healthy? It comes from fruit, And so I think that, that nutrition exposure, that I have to be honest, I don't think we do as good a job in schools as back when I was in school. I had to do home economics. And that's when they taught us a lot of this nutrition stuff. But those are places where people can start to get those early lessons about healthy eating. So I think that education is part of just what the individual kind of can experience and how they interact with food and exercise, but then the opportunities that further education gives, and kind of the economic inequality that's happening in this country right now as a result of those opportunities further increases that divide and then increases that risk for diabetes.
Yeah, makes a lot of sense there. Now, when we talk about the symptoms of diabetes, we talked a lot about carbs and, blood sugar levels. What are some other symptoms that would indicate that you may be at risk for diabetes? Kiya, I heard you mention pre-diabetes, but also if you have been diagnosed with diabetes, what are the symptoms that we look for? I'll be honest, a lot of folks, in growing up today, I know this, especially like for the Black community, this may be true in other communities as well. The family members that we have aren't always like truthful with us about what's happening, with their health until it's either too late or until, now it's time to, sort of like move in, a direction that we didn't necessarily have to go in if we would have, all been able to know and work together. So some of us who have family members or friends or loved ones who are dealing with certain illnesses also, need to know what to look out for. And so this question is for that, but also for, of course, those who are managing diabetes. Can you talk a little bit about the symptoms, Dr. Malek?
Mm-hmm. So I would say I think the most common thing is no symptoms. And that's why a lot of people can have diabetes and not know it. And the reason for that is, and I'm going to talk about the symptoms of high blood sugar in a second, but if your blood sugar is kind of slowly rising, you get used to it. And so people are functioning and walking around with blood sugars in the 300-400s and don't even know they have it. On the opposite side, if your blood sugar goes low, you feel that. All right. And so for people who have diabetes and are on medicines that can lower their blood sugar, one symptom would be if their blood sugar goes too low, and they may feel shaky, sweaty, their heart racing. They need to drink some juice or eat something sweet to address that. Some of the symptoms of high blood sugar, your blood sugar goes too high, you will feel really thirsty. You will maybe frequently go to the bathroom, so to urinate. You may feel particularly hungry, and it becomes almost like a vicious cycle. So I'll have patients who, by the time they're getting to me, the diagnosis, they're like, for the last, few months, I was so thirsty, and I would drink Pepsi, and I would drink Orange Crush, and I was drinking Sprite trying to quench my thirst. And then I would just be peeing all the time. And so then I was more thirsty and I would drink more of this, and it just kind of became this endless cycle. Mm-hmm. So those tend to be the main symptoms. The other thing that can happen is people's vision can get blurry. And so blurry vision can be another sign of the high blood sugars that people can have with diabetes. Did I answer? I think I answered
Yeah.
yeah.
Yeah, absolutely. That's so interesting. Because I didn't know that a symptom was no symptoms, and that is actually really kind of scary. To know that, we can just be operating through our daily lives and like drinking that, Pepsi or that Coke with that salad, thinking it's all good in the neighborhood. And we may actually be, pre-diabetic or, diabetic. What's your advice for, folks who this may be their first, real in-depth discussion about diabetes, or they're just now learning about the disease? They may not be diagnosed or pre-diabetic, or maybe they have. What is something that you would tell them as far as what to look out for and how to keep yourself informed? Are there screenings that you should do? What does that look like? And Kiya, I'll start with you there.
So if I had someone, wanting to know those questions, the symptoms, same as Dr. Malek, had kind of shared, increased urination, peeing a lot, tiredness I'll hear as well, headache. But oftentimes, of course, if they're in that pre-diabetes stage, they might not feel any of that at all. And it doesn't necessarily have to be pre-diabetes. It could be that type 2 diagnosis or type 1, whatever diagnosis it is. So just kind of paying attention if you're able. We're so busy in our lives, but just trying to pay attention to what might be different. If you do kind of notice, like Dr. Malek, some of those symptoms that Dr. Malek had said, check it out. There's nothing bad that's going to come out of that other than you knowing more information on how to try to address the problem. And no judgments whatsoever. I really try to share that with people. Welcome. We'll educate you. We're here to help. We want you to have the tools. There's no happier feeling I feel when someone's like, yeah, and I did this. And I'm like, yes, you go. Like, that is what I want people to be able to do. And I believe there's free screening. You can go online onto the American Diabetes Association and do free pre-diabetes screening. It's very quick to do. It'll ask you a couple questions. And Dr. Malek could probably share a little bit more about that, maybe on that end, outside of just following up with making sure you see the doctor, doctor.
If I could add to that, if you are curious, at University of Maryland, at our Midtown Center and our outpatient tower, we have a community health education center that's located on the ground floor of that building. You can walk in and have your A1C, which is a screening test. They'll prick your finger and they can do a screening test and let you know if you have diabetes or pre-diabetes from that. It is free. And then you're in the same building where if you needed primary care or specialty care for your diabetes or education for your diabetes, we're right there in that building. So if you're based in Baltimore and you're curious, that's an option for you.
Awesome. Thank you so much for that. Yes. And if you're just tuning into our live virtual event, welcome to Building Up the Health of the Community, Tips to Manage Diabetes and Stay Healthy on Your Lifelong Journey. I'm Chey Parker, and I'm joined by Dr. Rana Malek, who is a University of Maryland School of Medicine professor, and also, of course, a doctor, the University of Maryland Center for Diabetes and Endocrinology. Why am I always tripping over that word? I love it. I'm going to get it though. And also Kiya Rivera, who is a diabetes educator at the University of Maryland Center for Diabetes and Endocrinology. So thank you so much again for joining us this evening. We're going to continue with our discussion and switching gears a little bit into treatment and what that looks like. You both are at two ends of what treatment looks like for a patient. And so, Kiya, I will start with you as far as like what diet looks like, what that treatment plan is. I know it's very personalized. And as you were talking about before, you try to make it as practical as possible. But if you could also speak to the role that diet plays in the treatment of diabetes and like what percentage does that look like? Is it 90% diet, 50% diet? Look, they're like, what can I get away with? But no, seriously.
That's fair. Good question. And I do want to hear your thoughts, Dr. Malek. So we do have classes and we talk about kind of the different treatment options and different treatment methodologies and plans that someone with diabetes could potentially have. And it really does depend again on that individual, and kind of just throwing out there, maybe kind of how high their blood sugars are at already might be a certain thing that would kind of pivot us one way to another as far as what the provider might choose to prescribe for them. But if I'm looking at kind of different methodologies and what we're teaching patients is some people can do lifestyle and exercise. So what I mean by that is eating, right. What is right? And that does look different for everybody. But I would say I have had people, I throw it out there, they have their 3 meals a day. It works well for them. They make sure that they get 150 minutes of exercise, a week, maybe a little bit more, monitor those blood sugars. And they can go without maybe an oral medication for diabetes or insulin, for example. I may have that same patient doing those same things, but maybe their predisposition, they've got a lot of other factors that kind of impact, their treatment methodology. Maybe they have a heavier family history of type 2 or diabetes in the family. Maybe they, everyone above age 45 are risk for diabetes. Type 2 goes up. Maybe they're a little bit older. Maybe they have high blood pressure, high cholesterol, maybe a little bit of extra weight. And it could be those other factors as well that kind of drive what their treatment plan will be, and educating them on whatever it is, it's okay. It's not bad that you're on insulin. It's not bad that you're on oral. Neither one is worse than another. Type 1 in my mind is not worse than another. I don't know, right? I don't have type 1. I don't have type 2. So I really don't know. So it's a different type of work. And just letting that patient know that the main goal is trying to make sure they're healthy. They're as happy as they can be. They don't feel like, afraid to take their medications. They're not afraid that they'll have a low blood sugar from it. They're feeling comfortable and like they can do this. They have the confidence to manage it. And really kind of trying to build them up in that sense. And then letting them also know, use your support networks. We have a diabetes support group. It's free. We hold it virtually twice a month. And you can use that number for any contact information, but where we just share different topics and we have that connection and support. So many people with diabetes share with me, I feel alone, or they don't open up because they just feel like nobody understands. They really don't. And this is just kind of them sharing that with me. And so really just trying to build, whatever it is, it's okay. Let's manage it. And what does that look like for your goal? How does that fit into your lifestyle? We might be wanting that A1C or those blood sugars in target, but what's going on there? Like, what's that goal? And how does diabetes intertwine with that? Because it's their life with diabetes, right? And so they always kind of have to patients with diabetes are always having to think about that. So letting them know they have that support and using people to help, like you had shared, some people, they don't share with family members about, certain conditions. Anecdotally, if I find African-American men, they tend to share with me, they've had before, oh, I just can't share that. I'm a man, you don't get it. And I was like, okay, all right. And it can be really hard to get them to open up and know that we're there and we can help and they're not alone. So really letting them know they have support systems as well and staying connected.
Yeah. Thank you so much. Thank you so much for that. And Dr. Malik, what about on your end as far as orals may be concerned, or insulin, prescription drugs? What does treatment look like for the different types of diabetes?
Yeah. So for type 1 diabetes, where your body has attacked the insulin producing cells, it's insulin. And we have different ways that we can give that insulin. I think most people have type 2 diabetes, and it's I'm happy that over the course of my career, I have seen so many new options for the treatment of diabetes. And one of the things that I was just talking to one of our doctors in training about this the other day, is we have so many options that are not insulin. And some of them actually work better than insulin. And that is a really great place to be, because there's nothing that I think is more frightening than the idea of going on insulin. And for a lot of patients, they will say to me, when my grandmother started using insulin, the next year she had to have her toe was amputated, right? And they associate insulin with the bad outcomes of diabetes. And so, sometimes we have to use it, right? So someone comes in the hospital with a diabetic coma, we have to use insulin. But one of the things I will often say to those people is, I'm not saying you're going to be on insulin forever. And that what we need to do is right now use insulin to get on top of things. But if you do your part and I do my part, we can try to figure out, can we use some of these really powerful medicines for diabetes to help us get you off of insulin therapy. And so it's a super exciting time. We have 12 different classes of medicines to manage diabetes. And what's great about some of them is that they do other things that are really good. They protect your heart. They protect your kidneys. They protect your eyes, right? They, they help you lose weight if that's something that you want to do. And so I kind of sit there in the room with the patient, and I try to figure out, well, what are your priorities? What matters to you, right? Is it making sure the cost of the medicine is low? Is it making sure that you lose weight? Is it making sure that you never have to take an injection in your life? Okay, how can I work with all of my options over here to try to make that happen for you? And that's generally how I try to approach it.
That's awesome. That actually answers a little bit of our next question that we have from YouTube. That if you have to take insulin, are you just doomed to a life of needles? That sounds terrible. That sounds awful. Are there any alternatives? And you touched on that a little bit, that there are alternatives, and that there are medicines that can, assist in helping you get a patient off insulin who may be taking it, and maybe even better than insulin. Just really briefly, can you talk a little bit about what those different options actually look like? Are they medicines that, someone has to take daily, monthly? Is it surgery? I'm just throwing it out there because I'm definitely a newbie to the arena.
So a lot of the newer medicines for diabetes, some of them are pills, some of them are injections, but they're once a week injections as opposed to every day or multiple injections a day, which is what insulin is. And so no, if you are on insulin and you don't have type 1 diabetes, you can come off insulin. And this is actually one place where patients can advocate for themselves, because doctors my age and older, we trained in a time where we had very few options for diabetes. And so if someone's blood sugars were really high, we automatically said that person has to be on insulin. That's not necessarily the case anymore. So we can check and know whether a person's body makes insulin or not. So that's a blood test that we can do. And if a person does make some insulin, it's really worth trying to see, could I add some of these once a week injection medications that are very powerful at lowering the blood sugar to what they're taking, and back off of some of that insulin therapy. And so it's kind of been one of the big things I do. I do a lot of teaching at our medical school and at our hospitals with training doctors, is you have to prove to me that this person needs to be on insulin, because there are other options that are less dangerous, because if you take too much insulin, your blood sugar could go low, and other options that may require less monitoring on the part of the patient. They may not have to test their blood sugars as much. So if you're on insulin, it doesn't mean you have to be on it forever. I can't talk to each person's situation, but I really would say that if you're listening to this, advocate for yourself and ask your doctor, why do I really need to be on insulin? What are my other options? Because this is all within the last 5 years that this stuff has taken off. So it's like I said, it's a really good time to be doing diabetes care, because there's nothing that's like more exciting than taking someone off insulin and they come back to the next appointment and their blood sugars are even better. Like, we do a little victory dance at that time.
I love that. Yes, this is good. And that I feel like that's a ray of light for someone who may, be listening, who may be pre-diabetic or has diabetes, or who is currently on insulin and trying to figure out what their options are. And as we move into that discussion, I know we have about 6 minutes left or so. If there are any other questions, please feel free to put them in the chat, whether you are on Facebook, YouTube, or on one of our Radio 1 Baltimore websites. But could both of you talk a little bit about the resources and the support groups and the tools that are currently available at the University of Maryland Midtown campus in your respective areas?
So one of the things at our Center for Diabetes and Endocrinology is we have a lot of doctors, not just doctors like me who are endocrinologists, but we also have a lot of doctors who help with some of the complications of diabetes. So we have podiatry, so foot doctors who are there at our center. We also have kidney doctors at our center as well. And one of the things that we think is really important is to be on monitoring for complications of diabetes. And so knowing early on if there's any kidney disease is really important at preventing it from getting worse. So having all of your doctors in one place is a really nice resource to have. And then we have the most amazing education wing that you have ever seen. And I learned from that team so much. And so those are really, I think, the really special resources we have. And I'm going to let Kiya talk about those.
So we hold diabetes education classes at our center every month, every week. And insurances is going to dictate if you have coverage, but most do, and especially the Medicare population do have coverage for diabetes education. And it's actually just a once in a lifetime benefit. You get 10 hours that they will cover just to learn about diabetes. So our classes cover, we have 5 classes actually, and we cover all topics diabetes related. But what are your blood sugars supposed to be? Myth and facts kind of was reminding me a little bit of class doing some of these Q&A sessions because we do a little bit of a group activity that we have myth and fact cards. And as a group, we talk about, is this a myth? Is this a fact? And really, why is it a myth? Why is it a fact? And at the same time, bring the education piece in with it and that connection in that group setting, which I do love about classes. Because again, we have a population where, they might feel very, very alone and they might not feel like they have others. And so to get them in a setting where other people as well have the same chronic condition that they do, and they can open up and talk and kind of feed off of each other is really amazing to see. Sorry, I digress, but blood sugar monitoring, we talk about nutrition labels. Everyone gets a different nutrition label to read in class, and we look at the serving size and the carbohydrates. And then I use my rubber food models, which I love so much, to show different plates. What does a breakfast look like? What would be, a 60-gram carb meal? Is that enough? Is it not enough? What do you think? And kind of talk together as a group. And then each class, we also do a little bit of chair-based activities. We do it to music because that is one way that we can use our insulin better, is by moving every day and just getting in more activity. We can get our muscles to kind of want that insulin, eat it up a little bit better. So not only do we do that, we'll also talk about a full class on, what does physical activity look like for me with diabetes, or the things that I should be concerned with. Because with certain complications, we might not recommend, weight resistance training, or the provider might not have recommended that. And so we talk about certain things to be cautious of and how to build it in. That's the hardest part, right? We know we need to exercise and do all these things. And we know we need to eat right, but how do we build that in? So We'll talk about screening measures, really everything diabetes related. I love our classes. Obviously, I'm one of the educators, but I find that patients walk out I don't have people walking out feeling worse than when they came in. They're usually feeling better, educated. They just have a smile on their face, and a feeling like, okay, I know more and I have a little bit more in my toolbox.
And now I have a plan, and now I
Yes.
can, move on things. That's awesome. And this question here that we have, how do you get in a diabetes education class?
Yeah, so you can be referred directly from your primary care doctor, and we're specifically talking about diabetes self-management training. There's like an official term for it. You needed an acronym today, Chey, that you learned. So it's DSMT, Diabetes Self-Management Training. So we have those classes that we do provide those at the center. So you can be referred directly by your primary care, or if you're seeing a diabetes specialist, they can refer you as well. And we have our phone number on the bottom of the screen. I don't know off my head if you can just call and refer yourself in. That I'm not sure about. I can't answer that. But those would be ways to go about it. And when in doubt, call our center, and then the wonderful ladies on the answering line will know the answer to that.
Perfect. And I just wanted to add, if a group dynamic is a bit scary for some people, which it can be, we do individual sessions as well.
Yes.
And it can be really nice because the provider is there. Maybe your kidney provider is there, your eye doctor, maybe you're seeing the endocrinologist. And so next time you see the doctor, you can see the dietitian or the educator as well to get that education. Especially it's nice because then they talk with the provider and then they can talk with you and get a little bit more kind of, I don't know, details out of what kind of specifics they want to know.
Yeah. Yeah. Thank you so much. And yes, will this be streamed again on YouTube to watch? Yes, absolutely. You will be able to watch the replay on YouTube and also on any of our Radio 1 Baltimore websites, whether that's 92Q's website or Magic's website or Praise or WOBO. Before we head out this evening, it is 8:01. We want to thank everyone again for joining us. And it's kind of crazy because there's so many more questions that sort of arose in my head as we were having, this discussion. So much more, to talk about. I really did want to dive into Ozempic just a little bit, but we didn't have enough time there. But if there's anything from the both of you, Dr. Malek and Kiya, if there's anything that you would, tell someone about diabetes that is like one of the most important things to know, whether you are interacting or caring for someone with diabetes or someone who may be pre-diabetic or already, diabetic, what would you say to them? Something that you feel like everyone in this world should know about diabetes. And Dr. Malek, I'll start with you.
I think knowledge is power. So I think a lot of people, like, they think they're worried, and they just kind of are like an ostrich. They want to put their head in the sand. Know your health, right? That's the best thing you can do to advocate for yourself. Just know what your status is, what your health is, and know that whatever it is, there's a way for it to be better. And so avoiding it is not the solution.
Oh man, that was one I wanted. Outside of that, I'll add, because mental health depression is a bit higher in people with diabetes. Along with that, you're not alone. You are not alone.
Yeah. Thank you so much, Kiya, and also Dr. Malek, for joining me for this discussion today, all about building up the health of our community, tips to manage diabetes and stay healthy on your lifelong journey. For more information, if you want to know more about the University of Maryland and the resources that they have available and the information and the tools and the professionals there to help you if you are, dealing with diabetes in whatever capacity that may be, whether you have a child, you're a parent of, a child who has it, or a caregiver, or you yourself may be dealing with the disease, please make sure you reach out to them. The website is at the bottom of the screen, ummidtown.org/diabetes, or you can call 410-225-8000. Of course, please feel free to, does the center have social media pages? Do we know those? Maybe we'll include those on the replay link if those are available. But we thank you for joining us tonight on a Wednesday, on a hump day, to talk about this really important topic that is definitely impacting our community. Thank you for making it fun. And in addition to that, also to University of Maryland Medical Center Midtown Campus is where you can find the info on UMCDE on Facebook. So if you're a Facebooker, I am not on Facebook. Even though we are streaming live on Facebook right now, I myself am not on Facebook. So for all the Facebookers out there, you have the inside and can search the University of Maryland Medical Center Midtown Campus for that info. Have an amazing night and have a great Thanksgiving holiday season.
Thank you so much.
Thank you so much.